quite intimidating when you first start out using aesthetic treatments, and my advice would be to recruit from your own patients, your loyal patient base. If you're a long practicing skin cancer doctor, obviously you've got a lot of patients who've experienced quite significant sun damage in their life, and a really good tool to use in your practice is to use a Woods lamp, some device that can show what level of UV damage is on the face. And there are various devices on the market. When the patient comes in for a skin check, part of what we do is offer the total body photography and the digital dermoscopic imaging, but as an adjunct to that you can also get them to place their face minus sunscreen into a Woods light, and that really highlights how much sun damage and DNA damage there is on the face, and thereby gets them thinking about what they can actually do to improve things. Not only will you get patients who will be more compliant with their sunscreens because they see the damage, but they also start to think about skin health more and can then look at what can evolve from that. So just making patients aware that there is damage underneath the skin that we can't see on the, in a normal skin check is a good starting point, and then that will make them think about skin repair options. There are a lot of topical agents you can use to improve the skin, and a lot of our older patients obviously don't want to have more needles stuck in their face, so being able to offer topical treatments gets them thinking about all the improvements that can be made. They come back and get repeat photos, and then they start to think about all the other injectable options and PRP, those sort of things that we can offer as well. Once you get into treating aesthetic patients, a lot of people, doctors starting out particularly, have a fear that they're going to get the wrong clientele base, that they're going to get needy patients who are overly demanding or perhaps looking to alter their appearance too much the other way. With your ground base in sort of family practice and skin cancer medicine, we are very keen in achieving a natural look, and so the patients you get are the patients you deserve. So if you start doing ridiculous things that involve too many injectables and overfilling faces, you'll get the wrong type of patient. So it's important to sort of recruit from your own trusted patient base, and also separate your skin cancer work and your skin repair work perhaps on different days. It's not a great idea to mix doing a major flap or a complicated skin examination the same day as you're doing some injectables, and I think they're a different sort of setup in the way you run your practice for that reason. So I think when you're starting out, it's a good idea to make the aesthetic side of things, the dermatology side of things, more in a separate session. So away from all the family care, general practice stuff, away from the blood and the mess of skin cancer surgery, and more into a sort of a nice, clean environment where the patient, you run on time, the patients are there for a specifically different reason than it is to treat a cancer. So it's a different mindset. But once you get that sort of patient base and they come back year after year, it actually transmits into better results in your skin cancer work too, I think, because once you've paid that respect to the face and how it ages, we do better work when we look at a patient's face to remove a skin cancer as well. And you are a much more cautious doctor as far as what can go wrong when you do an operation on the face. And I think the other thing is the patients actually like it when they can walk into something that looks like a medical facility skin cancer as opposed to a beauty spa cosmetic place. So having that sort of banner of the skin cancer as well as the aesthetics upstairs, their friends don't look badly on them when they walk through the door and sort of seek skin repair options, because they could be there for a skin check.